just said, that we've had a very good association right in the beginning of the lockdown, where we had done a long series of 9 episodes, I can say, of research methodology. Six, we started off with some basic something which we were planning for one or two, but finally we said no, it has to be comprehensive. And Dr. Sriharsha was very supportive, and our association started. And hopefully, this continues for longer time. So thank you, Dr. Sriharsha and Sahasra ENT Foundation. Uh, so I will talk about the basics of communication. As Dr. Sriharsha has rightly said, many a times we do not really get any kind of insights, or we are not really told about certain things. It's assumed that we know everything, and many a times that leads to a lot of confusion in communication. So I will try to give you some insights, and I will also share some of my experiences, which hopefully will benefit all of you. And it would be nice to have some interaction. So at the end of this session, I'm planning to address these things. That means recognizing the importance of communication, identifying the principles of good communication, discover the power of well-written communication, appraise the role of nonverbal communication in healthcare, and justify the role of communication in medical practice and education. So as we must be thinking what is so important and why. So as we all know that we want to have a partnership with our patients, and it's important for us to have that partnership, because if we have them as partners, so they become well informed when we communicate well, and that will lead to loyal and continuing care with us. So we want that. We also want compliance. So that's important. And the added bonus, what happens is, it's not just that they become loyal, it also adds to work satisfaction for us. It gives us motivation, and it leads to increased productivity. Now, this is very important, because when we do something, we need some kind of a feedback mechanism. It reflects in the way people relate back or communicate back to us, and it also relates back in the forms of other things, like when we are happy, we are more productive, we are very satisfied, and it leads to motivation. And another good thing is, when we give some positive experience, it also leads to the people being more open or inclined to accept what we have recommended to them. And when that happens, automatically the compliance increases. There is people coming back to us again and again for ongoing care. So they become loyal, and then they become long time. So before I begin, I want you to go to this menti.com, open a menti.com if you could. On, say, if you're on a mobile device, it's very easy, you can do that. Or if you are on a laptop or a computer, you could open another say a browser window, or maybe another browser tab you can open, and you can just log in there. Menti.com you open, and once you do that, please put in 5709138. Now when it asks you to enter your name, you can choose to enter your name if you would like to. If you don't want to be identified, this is just for uh, having some kind of a starter and kind of warm up and fun, as well as also getting the gauge, the kind of your perceptions. So you can give yourself a pseudonym also, where you can take up anything that you would like to. Your imagination is just the limitation here. So let me try and go back to uh, so I will go back to, once you have done that, let me just go back to sharing it, and I will try to share my so are you able to see the screen, question 1 of 5, Dr. Sriharsha?
Yes, sir.
Yes, sir. Okay. So we'll just wait for some people to join. As they join, we will have more of this populated. So menti.com, and the code is 5709138. Let's have people joining faster. We need some more people to join quickly. Yes, that's better. Okay, so let me start. So you'll have some questions coming on your screen, and please answer that. So the first question is, communication is the foundation of trust. And let's see what you answer. And I wouldn't know who's answered what, so I don't need to. We just are doing a poll. Let's see what is your answer. Okay, so great. So you see, communication is the foundation of trust, and all of you, 14 of you are there, you all said it's true. Okay, where did I go? There seems to be some problem.
Is the share screen not working?
I'm not sure. That's what, something went wrong. It's stuck. That's okay. So here I have other few things. Maybe people can respond in chat or whichever. There is a chat here, Dr. Sriharsha.
Yes, sir. Yes.
Yes. So what do you think? Like, do you agree with this statement? Communication is a natural instinct.
Yes, sir.
Okay.
Yeah, you
So
can. Everyone can just post in the chat box.
yes, I can see a lot of people say that yes, it is a natural instinct. So I see a lot of names coming up and saying that. All right. Okay, good. So let's remember that. The next statement I make is, the art of communication cannot be learned. What do you say to this? Do you agree or do you disagree? So this is false. Okay. Disagree. Okay. Disagree. Right. A lot of names coming. I think some familiar names. So Pratik, Navin, Dr. Mohit Lavanya. Okay. So no. This. Right. Okay. Communication is the foundation of trust. Is it so? Agreed. Yes. Okay. Right. Let your responses come in. Okay, that's good. Okay. So I see all yes, yes, yes. Okay. So it is the foundation of trust. Most of you agree. All right. Now, next statement I make is, miscommunication is an annoyance, but seldom has serious outcome. So that means it may be annoyance, but it doesn't have a serious outcome. Do you agree or do you disagree? Agree. Okay. All right. It may not have a serious outcome, but it's an annoyance. Okay. All right. Somebody disagreed. Okay. Dr. Shaima Shahnaz disagrees. I see that. Nisha disagrees. Okay. So before I go further, let me tell you that yes, communication, we may think it's a natural instinct. For some people, it may be. But please understand, it can be learned. And that's why that second statement. So yes, it can be natural instinct to an extent, but we all can develop it. We can all, we actually can work on it, and we can actually learn it. Please remember, the concept that it's a natural or inborn talent is not really true. So it's a skill. And when it's a skill, all of us, you, I, everybody can learn it. In fact, I have actually learned it to quite an extent, and I still feel that I'm still learning it, because this is something which we keep on improving as we go along. As we keep practicing, we keep improving. So that's why the next statement is art of communication cannot be learned is actually not really true. So it can be learned. And of course, you rightly said that foundation of trust. So communication is the foundation of trust. And I saw that, one of the message came, Nisha said that, it can actually have serious consequences and all. So actually, miscommunication can sometimes have serious outcomes. Of course, it's an annoyance, but it can have. And let's, look at some of these things. So I hope I'm audible still. Okay,
Yeah,
Sriharsha, I'm audible.
you can go
Yes,
ahead.
because I just saw somebody putting up a message saying that I'm not audible or I'm not able to hear. So I hope I'm audible. Right. So communication obviously leads to increased patient satisfaction. It also leads us to have lesser number of complaints. If we communicate well and connect with patients, it improves our efficiency. So these are the things and we aspire for. Now, before I move forward, can someone put up what exactly is patient satisfaction? And is it linked to communication in some way? How exactly, yes, it is linked. Okay. Yes. Okay. Right. So please remember, patient satisfaction is nothing but, anybody who comes to any healthcare practitioner or a hospital, yes, providing what is so very rightly said. Yes, they need complete information. Not only that, they come with something in mind. So please remember, they will have some expectations. So when somebody comes with an expectation anywhere, and I'm talking particularly about healthcare right now. So
So
when
Praveen,
they come with an expectation, when they
yeah,
come
Praveen,
with an
say some.
expectation, and if we do not satisfy that expectation, there could be a mismatch. So what exactly is this patient satisfaction? If you put it in a say equation, basically what they perceive when they come to us or our hospital or our clinic or our facility. So whatever they perceive and what that expectation or what their picture there that is in mind, the difference of that sometimes may not be balanced, and that leads to dissatisfaction. So perception minus expectation is the satisfaction. Now this is one of the powerful sentence or a quote which I usually prefer to quote and always remember. People do not care how much you know until they know how much you care. Now, this is so powerful. So basically, when we communicate, we show that we care, we empathize, all that matters. And it's important for us to show that in our actions, not just doing something or maybe even giving them prescription. So we have to give that holistic experience, and that's why. So what's good patient care? It is, of course, my clinical skills, my diagnostic skills and everything. But along with that, it is also to understand and respond to what my patient needs. And sometimes that may be very basic need of just listening to them. Just listening to them. And also, thank you for that appreciation. So listening to them and also responding to it. So once we are able to do that and allay their apprehension, many of the times we would have got a patient for lifelong. And for that, it's important for us to understand the importance of soft skills. So it's important that we realize soft skills, including communication, has a much larger role to play, because many a times we just take it for granted. And that's the reason we have this today's session. So if you look at this, of course, this is a cartoon, but see what has happened is probably they didn't realize, like, the kind of, say, communication, or maybe the kind of the tuning between the people was not fine. And that's why he says that's why we lift on 3, 1, 2 and 3, and the patient is already down. So if you look at different scenarios that we might actually come across, whether it's discussing or talking to patients or convincing them, or sometimes counseling them, or sometimes presentations, or even in conferences or wherever, in our career we require it. So being in this health professions, we require it, and we need to actually have communication as our strength, and we can always develop it. Trust me when I say that, because I am a person who used to tremble in front of an audience when I was in ninth standard. And from there to when I came to 10th and then 11th and 12th, I had come a long way, because I was very fortunate to have supportive people in the form of my teachers, my principal, and my parents. So today, I can actually speak on communication. Not just this, I can stand up in any audience and talk. I'm not trying to boast, but that's what I'm trying to say, that I have seen many examples, and I'm giving you my example where actually it has been possible to learn, and it didn't take too long. Of course, initially we will have some inhibitions, fears, everybody has it, but we need to try to manage it. We may not overcome it totally, but we need to learn to manage it and use it in such a way where we can actually make it our asset or strength. So good communication is very important, because it leads to a better provider and patient relationship. It leads to better overall health, patient satisfaction, improved compliance. Even today's days, we have a lot of these malpractice suits and legal battles which goes on. So it helps us to actually reduce those chances as well, and improves our satisfaction. So this is actually documented. Many of the lawsuits actually are resultant from miscommunication. And when it comes to facing an audience, not just an audience of a big people, even sometimes 2, 3, 5 and 10 people, become very anxious and nervous. It's important for us to understand this. It's a two-way process where we reach a mutuality of understanding. We send information, we create and share meaning, and it could be anything. It could be thoughts, ideas, feelings, information, opinions, knowledge. But the crux is mutuality of understanding. And we do it in multiple ways. This is a graphic to show you the communication cycle. When you pick up any book or you go to any websites, they will talk about communication cycle. I have kept it very basic. Now, please remember, in this situation of the pandemic, we are using a lot of these means which are electronic, whether it's by phone, by video calls, by these kind of platforms. It could be anything, Zoom, WebEx, or MS Teams, or Google Meet, or any other thing. But we are using these channels also. So we have to remember that the basic principle remains the same. Now, at the moment right now, most of the time I am the sender. So I am sending you a message, and that's in a way which is kind of coded. Now, what do I mean by that? So coded means right now we are talking in terms of, this particular message is in the form of English and something which we know. Now, when I send this message along with my, the talk, as well as these graphics and your slides, you are decoding it. So you are the receiver and you are decoding it. And when I ask you a question and you respond, I'm getting a feedback. And that's the feedback I get. So that means my question is reaching you, you are understanding, and you're responding. Of course, sometimes it becomes difficult in such kind of channels. It's easier to read face to face and understand things by knowing their expressions, their reactions, their responses. But it is possible even in these kind of mechanisms. So this basic principle always remains the same. You will have a sender, you will have a message, you will have a channel. It could be verbal channel, it could be electronic channel, it could be written channel, it could be anything. And the person receiving it will receive it, will again give you a feedback. So when we communicate, we need to connect. And it's a connect from the person who's sending that message to the person who's receiving. And for that, we need to understand the psyche of the person. We need to understand how the audience is. Even if I'm connecting with a person who's my patient, a single patient or a patient and the bystander or patient and family, I need to understand them and then tailor my message. Once I am able to do that, I will be able to get across my message and I will get much better feedback as well as much better compliance. So there are different ways. How do we communicate? So there are different ways: verbal, auditory, visual, or written. So many a times people think they do a very good job of listening, but in reality, actually people many a times are only hearing, not listening. Now, what is the difference? The difference is not just in the terminology, but what happens is in hearing we are just passively or sometimes just mechanically hearing. But in listening, we are actually processing. So when this is being said, your mind is processing. It's already trying to make sense of that information. It's trying to make use of that information. You're trying already to think of application. You're trying to analyze and then, put it into something which will be useful. Now, why is it important? In our profession, in our healthcare profession, it's very important because we need to connect with people. Another thing is, it is well documented that people prefer talking rather than listening. Given a choice, I think most of you in the audience, if not all, would definitely like to talk instead of just passively listening. You would like to express. So that's one thing which is a truth. The next thing is capitalizing on what I just said in the previous slide. If I put up the right questions, I can get the information that I desire. So, in other words, if I put up a right question, I will get to you know the the people to talk about themselves and tell me the information that I need. In other words, I will get good history. I will connect with them. I will also know their problems of compliance or anything else. I'll come to the examples. Okay, so basically when you ask them, initially when you talk to them, you will ask them how are they, what are they like, doing, or what brings them here. And when you do that and you ask them that question, actually you let them speak, because another research says that many a times people are stopped much before they can actually complete a sentence or two. In fact, they say that anything between 8 to 20 seconds people are stopped. We don't even let them to proceed, to give us something about their problems. And that's again documented research. So when we don't do that, automatically, like, what happens is we get fragmented and interrupted history because we want to actually get things what we want. So if at all we let them speak for a minute or minute and a half or maximum 2 minutes, we will get a lot of things. Only thing is we need to listen to that and take out the important chunks from there and piece it together the way we want it. And then if there are gaps, we need to ask questions and then fill that up. So listening also compliments someone. It shows that we care. And that also helps them to connect with us, to build that trust, which you all have said is a foundation for a good relationship. So when we receive message, we need to listen, and that will require some concentration, some energy from our side. We also need to have a mental connection, and we also need to sometimes shed our judgmental kind of attitude and look at it from point of view of another person. So we need to suspend our judgment and evaluation. Now I will show you a video clip, and Dr. Sriharsha, just let me know if the audio is available, and if not, I will try to again include the audio from the settings.
Yes, sir. Okay, sir.
Many of us don't listen to other people.
Yes.
It's audible?
Yes.
Okay. Okay.
Instead, we just think and wait for our turn to express our own opinion. Take a step back and look at your colleagues' conversations. It's likely it'll look more like two monologues where everyone tells about themselves. The cure for it is active listening. It's a very powerful skill. It brings people closer, builds trust, and helps people to open up. Here are 5 steps on how to do it. 1. Stay focused. Keep natural eye contact. Don't judge. Be patient. 2. Really listen. Don't think about your similar experiences and what you should tell next. 3. Allow for periods of silence. wait till the other person speaks again. 4. From time to time, repeat the other person's words or paraphrase it back to them. It will reassure that you really listen and encourage them to open up. 5. Understand the emotions behind the words. When you paraphrase, also try to express the other feelings back to them. Active listening is rather difficult and can be more tiring than talking itself. Be prepared for long conversations. On the other hand, you will gain trust and people will simply like to spend time with you. You will also understand them much better. At the beginning, try it with your spouse or a good friend. You'll see how great they feel after talking to you. If you want to learn more about optimal lifestyle, subscribe to our
So basically, in active listening, we need to listen and we need to even check for their understanding. So when I'm listening and I say, okay, so what I hear you say or what I understand from what you've just described is that your complaint starts on these particular times, or you have this complaint and you feel better. So you need to paraphrase, check for understanding, and that, when you do that and you are also connecting and you're looking at the person, so that makes the person think that yes, you are involved, you care, and that's something which is a beginning of a good trustworthy relationship. So as I've already said, there are different ways. Listening is one. People think that listening is not important, but listening is very important. Speaking, of course, it's our kind of daily activity which we have to do and we must do, and that's something which we need to do. Reading, and then of course writing, all these are important and these are the ways of communication. Now communication skills take care of all these things, so we have to use these things in different ways. Of course, in our own day-to-day practices, in written we have a lot of things, including writing case sheets and other things, academic writing, even sometimes presenting things. Oral, we will have a lot of other things other than talking to our patients and colleagues, and so we will have even sometimes things which are related to our presentations in different forums. Non-verbal, we do a lot of things in our ways which actually sometimes without our knowledge will lead to people understanding or making sense out of it, and I will come to that because that's something which is very important and which needs to be, at least we need to be aware of. So it slowly, once we are aware and we try to make into a habit, it automatically comes. So verbal communication, it's oral, it's obviously use of speech. Now, other than what we do regularly and talking to people and the say patients and patient party, we also have other things like telephonic communication, which is also verbal. Now here I want to take a moment to give you some experiences. When I have interacted with my colleagues from many other departments, what I hear, especially from the lab and radiology, they say that many a times we get a call and the person doesn't identify himself or herself. They just want, we want so and so's report. Now, we don't know who that person is. Second thing, many a times we do not know that at what level we should, get back to them, or what should we give them the details. So it's always a good practice that when I call up somebody, I introduce myself, because the other person may not know. Even on the mobile phones, many a times people may not have saved your numbers. So it's good practice to identify yourself and say, I'm so and so. I'm say, if you're a resident, you can say I'm an ENT resident, first year, second year, so and so, I'm Dr. So and so. This. So you can say that, and then you say that, I would like to know. Again, the other thing is being courteous. It doesn't harm, it doesn't take too much of an effort. So what happens is automatically on the other side, the person who's listening and responding will have a different kind of an approach, because what happens many a times, they are also burdened by so many other things. Now the moment they see that somebody is not identifying themselves, somebody is not being polite or courteous, they also tend to, and we are all humans after all, however nice we would like to be, but sometimes you say that you had a bad day, maybe you are at the end of the day, and so you might actually reciprocate. And this applies both ways. It might happen with somebody doing it to me as well. So automatically when somebody speaks to me and courteously, the other thing is, if I call somebody not for reports and all, it's always a good idea that if I'm talking to somebody, if I'm calling somebody and when I do that, I say that, I'm so and so, and may I have a minute of yours? Or is this a good time to talk to you? So it's always a good practice. So at least we should try and make this ingrained. I have seen some people who do this regularly and routinely, and some of them are very senior people. And they are so courteous, polite, and they will do it every time they do call you. So this is something which we need to learn. I have learned it from one of my professors who used to always say this, that may I speak to you? Or may I speak to you now? Is this a good time? Am I disturbing you? So these are different ways. You can use these whichever, like, you are, say, comfortable with, and with different people in different ways. You can do that. But it's always good because the other person, if he or she is in the middle of something, or probably like, if he wants to know that in what context, you can always say, and then he or she, depending on the time they have in hand, they will get back to you, or they'll say, okay, continue. The other thing is, many a times we have to address people using a public address system. It could be in presentations, it could be in some kind of health education, or any other forums. Now again, we need to understand the basics of that, and also how our the message is reaching the others. So it's important for us to recognize certain things with that, and address in such a way that people are focusing and concentrating on us. Many a times we will be approached by radios, TVs, and again, we need to know the audience, we need to focus. Many a times what happens is, we are concentrating on things which we know, and we use many a times the jargons. Now, these jargons may not be understandable by people who are lay people. So if we are talking of, say, mass media like radio and TV, we should try to simplify things, connect with people. And of course, in conferences and all, we need to know how to communicate in lectures, meetings. So I've already talked about, let's connect with people, right? The interpersonal factor also comes into play many a times. If you meet somebody, or if you know that person, many a times, like, if you greet them by name, or give that smile, automatically there's a difference. So it's good to try and greet people by name, and let them speak, or you speak, and then let them also have an opportunity to speak. Don't interrupt in between. If you're talking to a patient, greet them by name, give them a smile, stop by and say, you know how are you doing today? If you cross them, sometimes you can say that, how are you doing? Is there something that I need to know? Your colleagues, even the ward sister, you do that, you will see a different kind. You do it for some time, you will see the different kind of approach. So that is again something interpersonal factor. Now this is something which I again bring up. So you read this, it says, I didn't say you were stupid. Very simple sentence, right? Now the same sentence will mean different if I do it here. I didn't say you were stupid, meaning I didn't say it, I meant it. Right? The emphasis of the word can change the meaning. For example, here, I didn't say you were stupid. Now here the emphasis has shifted to you. The sentence is same. But here I'm not saying you are stupid. Anybody else, he, she, they, any other person can be stupid, but not you. And same sentence, I didn't say you were stupid. So you're not stupid, you can be anybody else, but not stupid. So you see, the same sentence, when I say it in different ways, the emphasis shifts, and that makes a difference. So all these things are part of, the way we render things. Many a times we have certain words that we keep repeating. Like in this particular thing, you would have noticed I'm saying many a times, many a times, many a times. And that's again something we'll catch on. So I'm aware now, and I will try to make an amendment. So that's important, that we know what we are doing, and it's a good idea sometimes to get somebody to observe and give you that feedback, and let's be open to that feedback. It's also important sometimes to record yourself for important presentations if you're planning for, and then listen to it, because that also gives you good practice. For example, if you're going for a conference, so it's important to know all these things when you're beginning, say maybe giving say lectures, or even sometimes classes. It's good to have somebody give you feedback, or record yourself if not, or practice in front of a mirror and see, and that's good. Coming to written communication, You will require to write orders, instructions which have to be followed, and sometimes even letters, references to another department, going by different kind of roles that you may take up later. You might have to write memos, you might have to write reports, you might be part of policy manuals because you do something and you will come out with policy manuals. It could be in your own setup, it could be larger setup, government, other things. Sometimes information bulletins have to be released, especially in certain cases. And then it also comes in handy when we are communicating in forms of SMS, WhatsApp, and email. Now, that's something which we are now routinely doing because that's a mainstay of our communication, the smartphone. So, a few things here we should keep in mind. When we do this, one, our message has to be clear. It should be legible, it should be clear, and it should be very concise as well as crystal clear. So that's something which we have to do, because especially when we are writing orders and instructions, we have to be clear, we need to sign, we have to document, and we have to date it. That's something which is important, because tomorrow if there is a issue, if there is a problem, if even if it's a litigation, we will be saved by that. Of course, that goes into a medical legal territory, but then that's important for us to know. The other thing is, when we write letters or references, again, many times will not be known by the other person, or the person who sees that will make a picture of me by seeing that. So if I write a letter, if I write some kind of a reference, I am conveying to that person about myself. So it's important to address that. I will show you again, how it can make a difference. So if I just show you this, it's a simple thing, but the punctuation can change things. So the meaning is again changed. If you see, the three sentences are similar, but just the punctuation changes the meaning. So it's important for us even to pay attention to these things when we write certain things. And if we are writing to apply to certain places, definitely it's important. I have been in positions where I had to look at, people's CVs or job applications. I've been in administration. I also had, students and postgraduates writing letters, and I will show you some examples. It's very important that these things are paid attention to. And if you're applying to a particular post and positions, and or if you're applying for a say job, or maybe a degree abroad, or any kind of a course abroad, this becomes even more important. So when you write these things, you have to be careful. Even when I'm writing of a person about letter of recommendation, it's important for me to concentrate on certain things. When you write a reference for opinion or consultation, so you must give them some background about that patient, not just that, please opine about this. So if you give some relevant thing, even when I write a slip for investigation, they write sometimes brief history or brief clinical presentation. If you give that, the person who's looking at, say, if it's a pathology, biopsy or something, they will get an idea and they'll be able to corroborate and correlate with that. So it's important. Similarly, when I write a consultation or opinion from another colleague from another department, I need to give some background, because otherwise, blindly, if I go, it may be sometimes difficult. So you have to give some kind of a background, and then courteously you must write that, okay, based on these, kindly opine on these things, or we would particularly like, kindly examine and give your opinion. And more importantly, if you're particularly wanting something, please mention that. When you write emails, again, when you write to your colleagues or your seniors or superiors, you need to write in a different way, similar to WhatsApp and SMS. You might be very friendly with somebody, but when it comes to hierarchy, you need to maintain that, because that's something which happens. Another thing which I say is, it's important to not use SMS lingo or SMS language in emails, formal emails and formal letters and formal applications, because that happens many a times. I'm showing you one of the examples, especially with people on smaller screen, it may not be clear. So I'll just read out the important aspect here. So here, if you see, this consent has been handwritten. And now again, many a times this will happen where consents will be tailor-made for each purpose, because Supreme Court recently had given a judgment. You cannot have one size fit all. You cannot have a blanket consent. So it might come again in vogue, and that's why I'm showing you this. So this person is being taken up for dialysis, and he's been explained about all the things. So he says, I've been explained about the complications associated with dialysis and dialysis catheterization, such as bleeding, hematoma, infections, and injury to secondary structures. All these, some complicated terms, do not know how much patient would have understood. This is from one of our government hospitals where we are attached. And in spite of all these, I'm giving consent for dialysis and dialysis catheterization. Neither the doctor nor any other hospital staff shall be held responsible for any untoward outcome, including death. Of course, any untoward outcome can happen, but this kind of consent I do not know, and this might sometimes be really put off for a people. So we need to be a little more concerned and write it explicitly as well as explain it in some clearer terms. Similarly, if you see, there are letters which are written which cut a sorry figure. Again, if you see, when we come back and we want to apply for certain things or say financial assistance, there has to be a way. So you write something in background and you can give a description. And now this is actual curriculum vitae of somebody who submitted. So again, you see, this gives an impression about the person. So I may not know the person, but I get an impression. Similarly, when you see, when you write personal statements, many a times you will see when the abroad universities, they will ask you to write a personal statement, write also why you want to apply for this. They are also trying to test your communication skills and looking at what is your motivation, both the things. So they do analysis of these. And sometimes people become very smart, they will try to get somebody else to write. Now that, when it doesn't match with your application different sections, they are also smart enough to pick it up and say that this is not congruent. Another thing what also takes care of that is, following that, shortlisted people may be actually called for a video interview or a telephonic interview or a Skype interview. Now that also leads them to judge you. So it's important for us to actually give what we are and take care of certain things. Like I showed you here, this is a spelling mistake. So it's not good to actually do that. And again, how we write it and then that SMS lingo, all that is important. So again, here if you see, somebody is applying for a particular position and then is writing things which are not really in a good taste, and then talking about pulling off this post, and I can handle this, and it's all too much of me centric if you go through that. So when it's a team game, you keep saying I, again it may not go very well. So it depends. Look at this again. Here, this is a particular letter. Here the person is trying to take a particular uh, test later, and here instead of requesting, it's an information which is being given. So the way it is written, it also conveys, so I'm going for my brother's marriage, so and so, I'll return on this date. And then after all that, there is a big mistake. If you see this act of kindness, it's kindness obviously understood, but this is actual thing which I'm showing you. So all these things, there was a thing which says I'm going and I won't be able to. It's more of a, like I'm telling you, instead of asking for a or requesting for a permission. So the tone makes a difference. Similarly, when people write back to ask for sometimes recommendation letters and all, it's good idea to remember to identify yourself here, which has been done. Then also tell a little background. Sometimes they might be doing it after a couple of years. People may not remember everybody until unless there has been an outstanding connect or the person has been outstanding. So it's good to give a little connect and background and say that, I have done so and so, and I would request you for recommendation letter. These are my strengths, or these the things I have done, and these are available. And I'm also attaching some of these documents. Please go through it, and then also think about, writing and back reminding. So there has to be a formal mail, details about self, and time when a person was student, what was the achievement, any particular emphasis that person wants on the kind of say recommendation. So all these things are important. Then any deadline, and when you write to these people, most of them may be busy or they may have certain things at hand. So it's a good idea to again think of reminding, say even shall I follow up or remind. And please remember, once somebody does that, also get back when you get something based on those recommendations. So this is, again, I'm showing you with name because this is one of my students who again recently again wrote back. This is earlier, but recently again wrote back. So it's always good because that makes the other person feel good. The other thing is you also kept that connect, and next time in future this person requires something, probably I'll do it on a priority because I've always had that connect, and then this person has been following up and also giving me that information and giving me that credit. It's a simple thing, might take 2 or 5 minutes, but that's important. Now, another thing, the importance of communication. So you look at this is one of the universities abroad which looks at things like communication. So intellectual ability and communication, oral communication, written communication, both, and that has to be scored. So when they ask us to fill up forms for our students, when they apply for certain things, they ask you to judge them on their communication ability as well, and so many other things. Now I'll move on to another section, which is one of my favorites, non-verbal. Now, you would have realized, and this I thought like just yesterday and today, that when we communicate with children, very young children, they sometimes may not understand everything. But the way we communicate in our body language gives them an impression. Similarly, with pets, we don't speak the same language, but they understand us. Sometimes, if we are angry, they understand that. We are sad, they understand that. How do they do that? So there's a connect. They understand our body language as well as the way we perceive things, and of course they have that sixth sense of extrasensory perception. So it's important for us to know that verbal is important, but it makes only 35% of what we do. Non-verbal is 65%, and this is again from research which says 65, and some other places have found much more than 65 as well. And what does that include? It includes facial expression, the tone of voice, which I referred to some time back, the movement that we make, the appearance, the eye contact, the gestures, my posture. It's important. So body language will include all these things, and some of these I'm emphasizing on, and I will try to give you some important, aspects of that. So facial expression, of course, in this distant communication, I'm still trying to look at you and look at the camera, which will connect with you, but it's important for me to do that. And that's another reason why I would like to talk to you with the video on rather than video switched off, because in a session like this, at least you get to see the speaker and the kind of the emotions and the kind of the body language as well as the eye gestures and facial connect and facial expression and the connect. It's important. Similarly, the posture. Now the posture tells you lots of things, and I'll come to that. My expression. Now, I give this talk very seriously with my look like this, and I keep very straight face and talk. That may not be very pleasing for everybody. But at the same time, I keep varying my gestures, my facial expressions, my smile, and that will make a difference. If I frown every time, that also, not just straight face, but frown, and people don't connect. Now you look at those figures down. The person who's standing like this is with a closed gesture and shows that I'm not open to things, and I'm just me centric kind of a person. Whereas the person with the open gesture is more inviting and people would like to connect and talk to that person. Similarly, sign language has its own importance. When we point at somebody, that can sometimes show that I'm trying to point a finger or I'm threatening somebody, or so that is sometimes taken like that. Whereas same thing can be done like this. So with the open gesture. So open gesture versus this is different. So it depends where I want to use that and where what I want to do. Similarly, many other gestures convey different meanings. Like this means I do that to say that it's very good and I'm trying to appreciate somebody. You see that closed and open posture. So it's important, and the stance itself makes a difference. Similarly, my hand gestures. So when I stand like that or with that look, it gives a different impression. Similarly, if you see on your right, the person with hands in the pocket and then that kind of an expression gives you a better kind of a picture compared to the other person, but that's not the best again. So it's always good that person is relaxed with the open posture and a stance which is easy compared to a closed one with a stern look and a very close stand. Similarly, slope, sloped kind of, and couch, this thing, the sloping kind of posture with the shoulders sloping down is not a good idea. It gives a picture that you are exhausted, or maybe you're not interested. At the same time, you look at the other person, he's open, he's looking very relaxed, and is speaking very clearly and fluently. So these are some things which we need to do. Similarly, when we talk to somebody, now when we talk, how we respond is also important. So you look at it, the person is frowning, and that may send a wrong message. Similarly, if somebody is sitting down and talking to me when I'm standing, will also give me a kind of a positional hierarchy or power differential. So that's again there, and that is sometimes not good when it comes to colleagues. It sometimes vitiates that that atmosphere which is there, which will not be very comfortable. If you look at these, again, the person is being talked about and talked to, but is not really listening the down picture. So that's again important, that you listen actively and try to understand, because if it's not happening, again, that creates wrong messages as well as sometimes leads us in problems. The facial expressions I've already talked about, it actually tells the people what we feel and how we feel. So it's important for us to know that and realize, so that we can use it to our advantage. And please remember, silence and touch has its own importance. Many a times when people are just telling you things which you must listen to, and then maybe you cannot do much, just listen there, be silent. And touch, of course, when I say, with a little caution, the gender differences as well as the age, you'll need to think about it, because sometimes that may have its own connotations and it can land you in trouble. So you need to think about it when you are using the touch. It has to be with caution. With that, I move on to the segment on just giving you some important tips before I conclude. So communication skills, you need to assess. You need to assess the situation, the condition, and then based on this, you build your message. So if I'm communicating to, say, a patient party about a particular condition of their, say, child, or a relative, I need to assess the situation, I need to assess their understanding, and then build my message. And then when I do that, I need to also document it. And of course, I would have delivered it. So I need to document, because documentation is very important. If I don't do that and I communicate, tomorrow, again, there may be issues. So with that, you will have different situations. Many a times you are talking to your boss, he has very little time. You need to tailor make your message in such a way that you will catch the attention. And if you think you need more time, you just get that attention and you say, I need to discuss, and these are the things. However, I can come back and discuss at convenience. Maybe you can give me an appointment. Similarly, if you're talking about certain thing which has outcomes, or the process is important, you need to emphasize on that. So I will show you a short video again and then wind up.
What's the recipe? We're going to think about our as a meal. What are the ingredients that we need to have present in the meal? How do we put together a great meal? Well, let's think about it this way. There are really 5 ingredients that have to be present all the time. Great communication possible. First ingredient is clarity. How do you make it? Got to be clear. Second ingredient is brevity. How do you get to the point quickly? Not with time. Third ingredient is context. How do you help people see how your point or how your message fits in for them? How does it make sense for them? Fourth ingredient is impact. How do you make it stand out? Verbal. Fifth ingredient is value, which is fairly self-explanatory. How do you make your message valuable? So 5 ingredients go into every communication. clarity, brevity, context, impact, value. Okay, great. So we've got our ingredients. Now the next question is, how much of each ingredient do we need? Just like cooking a great meal, that's going to depend. Different meals are going to need different proportions. Different audiences are going to have different palates. They're going to want things added. So the really savvy look at their relevant, going to be able to determine based on the audience that they're messaging. What ingredients need to be dominant? How do you? Well, when do we need clarity being important? Well, there's a lot of complexity around the situation, around the issue. You need to make sure that your message clarity is when we need a bit of brevity. When time is short, attention's short. Your audience is very, very senior. You want to make sure you have enough context. Well, maybe when there's unfamiliarity with the topic, or maybe when you're people that have a lot on their mind, or walking in, listen to you, having just come from something very, very, probably want to make sure context. How about impact? We need to have a lot of impact. That's a lot of noise. Really need to work hard to be memorable. Really want it to stand out. That's hard to achieve. And the fifth and final is value. I think when there's skepticism, when there's choice, there's competition, the decision has to be made. There are other choices that could be. You have to work hard to make sure that there's value. All five of these ingredients are present every meal, every patient. Always want to make sure that you have some clarity, some brevity, some context, some impact, some value. But depending upon who you're preparing, you're going to make choices. Which of those think about your communication. Preparing for an audience, want to have different audiences have balance, which means you have to adjust the ratio.
So I hope you got that message that you need to decide based on the audience and what is the importance of that communication and decide on these ingredients. So as he rightly said, all the ingredients will be there, but you will have to choose and then decide on which one has to be more, which has to be less. What makes a good communicator? So you need to have clarity, you need to have adequacy of the message, a good sense of timing, and then one thing which is very important is integrity. Integrity means doing the right thing and doing the right thing every time, even if nobody is watching. So people can make out that integrity. It comes naturally that people can sense it, because once you do it properly and genuinely, people will definitely connect. So this is something which we make as an image. So basically, I will sum up by these two quotes. The good clinician treats the disease, but the great clinician treats the patient. And this goes with holistic nature of the whole thing. Sir William Osler, great person who said this. And Sir Winston Churchill said, if I had more time, I would have written a shorter letter. Means if you need to concise, if you need to make your communication shorter, you need to prepare much more. Please remember these two things. So basically, for good patient care and outcome, I hope I have given you that message that clinical skills and soft skills are equally important. You cannot have more of one and then not pay attention to the other. So clinical skills are important, but soft skills, including communication, is very important. Every good conversation starts with good listening, and good communication entails more than just spoken or written words, which I have tried to give you an idea about. So I end with my acknowledgement to certain people. Dr. Mary Beth Scallon, who actually initiated me into a lot of these issues and the concepts about communication when I attended a whole day workshop with her a couple of years back, and then KSG Famer and then Mahe Famer Manipal, and the medical education unit of KMC Mangalore, and of course Sahasra ENT Foundation and Dr. Sriharsha Tikka. So thank you so much for being a good audience. I would be happy to take a few questions if at all there are.
Thank you, sir. It was a very great lecture, and indeed, I mean, I personally feel I should change my communication skills. Something I had some very interesting learning I had today. So I would open up the audience. Audience, they can just unmute themselves, and in fact, it's just so. We have a lot of congratulatory messages, sir, in the chat box.
Thank you so much. It's good to hear that.
So, the audience, if you want to, wish to interact with sir, you can unmute yourself and before we wind up the session. Ranjana ma'am, do you wish to speak anything, ma'am? Ma'am, can you unmute yourself? Yeah.
No, not really. It was a wonderful talk and very well put together. I think we should have more of these talks, especially for students and PGs. They really need it, Of course, we need it too. We do make mistakes, but they need to be sort of inculcated into them. All these points should be done that.
Thank you so much, ma'am. Thank you so much. Yes, you're right, definitely. And what we have started doing at KMC Mangalore is we do it for all the interns and postgraduates. We do a small session. And recently what we did was we have started, I think 3-4 years back, I started a 3-day or 4-day module we've done as a, of course, as an optional thing, where they actually come in and do these communication as well as soft skills related module. So that is also something which we have started, and our dental college has recently started some of these things, which is again optional, and that's a longitudinal thing which goes on to from first year to second year to third year. So that's again I'm involved with them. So we are trying in our own ways. We were not so fortunate to have been told so many things, and we've learned by experience the hard way. But I think going forward, at least we can share some of our experiences. All of us have had these experiences, and I think we build on that. So thank you, ma'am.
But would you like to come out if we were to call you to our institute?
Sure. Where are you based, ma'am?
I'm at Chennai, actually.
Oh, thank you. Sure. I do. Actually, right now, I mean, I go for a lot of things also, but right now from, March 12th was the last time I actually went out. After that, I've been grounded. Some of those things, because I go for ethics and these soft skills and other things. So after that, we've been grounded. A lot of programs in Kerala and other parts of Karnataka got grounded because of this. So now I think we'll have to wait for some time. But yeah, sure, ma'am. We can look at, the possibility like that. Thank you.
Thank you.
So, sir, I think we can wind up the session, sir, for now.
Sure.
Yeah.
Thank you so much again. It's been a pleasure. Okay. It's always a pleasure to connect with you, Dr. Sriharsha, and thank you for this opportunity. And
Yes.
this is really nice, and I'm hopeful that some people will at least imbibe some of these things and try to practice it. I do understand that 1 hour will not make much of a impact and change, but definitely some of these things we learn, and then that awareness itself, and then growing with that and trying to implement will make a change. So thank you so much.
Yes, sir. Fully agree with you, sir. Thank you,
Yes.
sir. Have a good night, sir.
Thank you.
All the audience for patiently listening and being with us
Yes.
since 1 hour. Thank you all. Have a safe day.
Yes. Thank you so much.